So it's absolutely safe in most situations to have a second breast reduction. So let's talk about it for a sec. So in general, it's always safest if you're at least 5 years out from your first breast reduction, because that allows the tissue to form a new blood supply, to have that well established. So when the surgeon goes back in a second time, your rates of problems will approach a primary or first time reduction. So it's always best, if at all possible, to wait. So my patient today didn't wait. So she didn't have a reduction that got her small enough and didn't like the shape after about 18 months. So I went back in early. And this can be a little riskier and it's a little more limiting for the surgeon. So I had to repeat the reduction in the same way her prior surgeon did. So I can't just go in and do the reduction any way I want, as you can if you're more than 5 years out. I had to respect the first reduction. So I got the op report from the other surgeon, obviously read it and made sure I knew exactly what was done, and I repeated the process. The other thing to consider when you're having a second breast reduction is you do typically have to use the same incisions. So if you've already had an anchor pattern, we will use an anchor pattern the second time around. If you start with a vertical pattern, we can do a vertical pattern again usually, or you can convert to an anchor pattern if needed. I know that doing surgery a second time is not ideal and it's always very scary. I think it's a little scarier when you're a little older too, because you know more, but we absolutely do this all the time safely. I did it today. Talk it out with your surgeon.